Hello, my name is Morgan Conley, and this is my presentation entitled American Indians and the Health System. It's for the Department of Nursing of Goshen College. The class is PJCS, Disparities in Healthcare, with Professor Julie Yoder. Our beginning in history. Since 1776, America has endured many events, some heroic, some devastating. Although we enjoy many privileges that come with living in America, there are still disparities and inequalities which persist today. It is no secret that Native Americans have suffered with the birth and growth of the U.S. as we know it today. From poor financial status, healthcare disparities, and prevalent mental health issues, they face many challenges today on an unfair playing field. As many know, prejudice against Native Americans has persisted for centuries. In the early 1800s, a writer by the name of Frederick Jackson Turner wrote that their role was an opponent of the expansion. He was referring to the new frontier. He firmly believed that while Indian trade was essential in the progression of American civilization, Native Americans themselves were a danger which demanded a response. They were essentially something to be rid of. Based on a study done by Wilking, Summerfield, and others, we know that American Indians are at an increased risk of being without insurance. This leads to increased morbidities, decreased quality of life, and poorer health outcomes compared to other aging populations. American Indians also have higher rates of mental illness and substance abuse when compared to neighboring populations. Fielding, Blendon, Benison, and others conducted surveys which found that American Indian adults living in rural areas had issues accessing health care, with 28% of them reporting issues with the quality of care they received and 28% reporting issues with medical bills. There were also reports of discrimination and violence. And as you can imagine, with these reports of violence and discrimination, there is probably a hesitance to seek out medical care. According to Sarsha and Spiker, studies have proven that 25% of American Indian children live in poverty. This is more than twice that of the general population. Within tribal communities, this number skyrockets to 40%. This population has higher dropout rates, lower labor force participation, and increased unemployment rates. Sarsha and Spiker state that, quote, disparities in health have existed among American Indian people for 500 years. However, our understanding has been poor due to the lack of proper data. There is a small amount of data here, and it is old, end quote. The Native American median household income is similar to that of African American households, but they experience a lower growth rate. In 2016, it was reported that their income increased by 1.8%, that's about $40,000 per year. However, this growth did not alter the fact that from 2015 to 2016, 33% of American Indian children still lived in poverty. Within these communities, there's a lot of violence and unfortunately SI. So with high rates of poverty and poor education within a community, incidents of violence are likely to follow the trend, and they do. Sarsha and Spiker also point out that American Indians are likely to experience violence and traumatic events involving near-fatal injuries, threat of injury to self, or witness to threatening behavior. Of any race, they have the highest per capita rate of violent victimization. Children from the ages of 12 to 19 are at an increased risk to be victims of serious violent crimes and assault. American Indians are more likely to be killed in motor vehicle accidents, commit suicide, or drown when compared to their Caucasian and African American counterparts. Referring to suicide, the children within this population have high levels of trauma among family and friends. 11% report knowing someone who has committed suicide. The suicide rates among American Indians are up to 6 times greater than non-Native Americans. It represents one of the greatest health disparities faced by young people within this community. So, reading through those statistics, it's probably easy to think, okay, these are awful. What can we do to change them? I believe that increased funding to the IHS, or the Indian Health Services, would be a great start. It was reported that they are so incredibly underfunded that they spend approximately $1,900 per person per year, And just to put that into perspective, we spend over $3,000 per federal prisoner per year. American Indians clinging to their traditional and large extended families. There's evidence to show that when they have deep bonds within their families, when they identify more with their more traditional beliefs, this does offer some protection against some of the negative statistics that we just read. Increased education surrounding health, wellness, and prevention. An increased and efficient number of mental health facilities. And the addition of skills workshops so that inhabitants may develop their skills. I believe that with education, this could increase the health outcomes, make an increased quality of life for this community. I also think that with workshops, this could help the financial aspect, the amount of poverty that we see within this population. These are my references, and thank you so much for listening.